The World Health Organization in the Western Pacific region celebrated World Health Day 2013 by honoring Philippine President Benigno S. Aquino III for his outstanding contributions to public health. The day's theme was hypertension, or high blood pressure, which is linked to the epidemic of noncommunicable diseases that account for 80% of deaths in the region. The World Health Organization is the public health arm of the United Nations. The region comprises 37 countries and areas of varying cultures and degrees of development, and is home to more than 1/4 of the world's people.
The World Health Organization was created in the years right after the death and destruction of World War II, because the visionary leaders who created the United Nations also believed that there should be a global public health agency to promote public health. They made a constitution, and on the 7th of April 1948, this constitution went into force.
World Health Day marks this anniversary. The celebration at the WHO Regional Office for the Western Pacific in Manila fell on the 65th World Health Day and was made more memorable by the presence of President Aquino and dignitaries from his government, the diplomatic corps, and a plethora of health-related non-governmental organizations. It was fitting that the theme be high blood pressure, given the enormous toll of illness and premature death that the condition exacts globally and on the region's population of 1.8 billion.
Today is WHO's 65th birthday, and every year we are celebrating as a birthday World Health Day. And this year we select theme as hypertension, high blood pressure. High blood pressure is killing people. It's more than 9.4 million people each year. It is silent and invisible killer.
"65 years ago, when the World Health Organization was founded, the major causes of death in the world were infectious diseases like smallpox, malaria, tuberculosis. After many years, the World Health Organization, in its work with countries, has been able to control many of these infectious diseases. And if we think about what the leading causes of death are today, we now know that 63% of people all over the world are dying from non-communicable disease. There are risk factors for these non-communicable diseases, and hypertension, or high blood pressure, is one of the most important risk factors for non-communicable disease.
The World Health Organization in the Western Pacific region made President Aquino the first recipient of its new WHO recognition for Outstanding Leadership in Health Award.
This is the first time that we're giving a recognition for outstanding leadership in health. This is being given to the President of the Philippines, Benigno S. Aquino III, for his steadfast and unwavering promotion of universal health care, syntax reform, and reproductive health. This is one of those rare times where we see a president taking bold steps and actions to support public health policies that we believe will truly benefit millions of Filipinos.
The honor given to President Aquino is poignant because 25 years ago, his mother, the late President Corazon Aquino, celebrated World Health Day 1988 in the same WHO regional office. Like his mother, the current President Aquino makes healthcare a priority of his administration.
Everything that the President has started to push and that this administration is pursuing will result in an overall reduction in high blood pressure in the general population in the Philippines. This will happen when universal healthcare is realized, then that will have an impact on high blood pressure. The syntax reform is also something that will result in the reduction of blood pressure in the population. The increase in prices and taxes on tobacco will discourage smokers from smoking. Same is true with alcohol. Excessive drinking can also contribute to high blood pressure. And last but not least, the reproductive health law will also give mothers a chance to have better health care. As I said earlier, 10% of all maternal deaths are from high blood pressure.
The official ceremony took place in the regional office's conference hall on April 8th.
His Excellency Benigno S. Aquino III, President of the Republic of the Philippines. Please be seated. Welcome to the celebration of World Health Day 2013.
President Aquino is not a medical doctor, nor is he a public health specialist. But what he has achieved is beyond what any doctor or public health expert could have done. He has shown perseverance in pursuing better health for Filipinos, sometimes against formidable resistance. Mr. President, you are an inspiration to leaders in our region because you are a humble servant to the needs of your people. The World Health Organization recognizes your outstanding leadership on this World Health Day. Thank you, Mr. President, and thank you for all for attending. Thank you very much.
Thank you, Dr.
His
Shin.
Excellency Benigno Simeon Aquino III, the President of the Republic of the Philippines.
We have just begun to regain our footing as a free nation. I believe you chose my mother to address you then because of what she represented. A people that valued life and saw that compassion was the most powerful weapon against injustice and oppression. The belief that we all had a duty to protect and care for the most vulnerable members of society. These are the same bedrock principles upon which the World Health Organization was founded 65 years ago. Principles you live up to this day.
Thank you very much. Once again, ladies and gentlemen, the President of the Republic of the Philippines, His Excellency Benigno S. Aquino III. Thank you.
While the dignitaries and staff celebrated, others at the regional office were busy responding to a major public health problem.
You know, it was a very exciting and meaningful event today. But for me, I must say, you know, it was a very poignant moment when the group photo was taking place, because I noticed that somebody was missing. And the person who was missing was Dr. Elan Lee. She's the director for health emergencies. WHO is actually in the middle of managing an actual and urgent public health emergency, and that is the outbreak of H7N9, human infection with H7N9 influenza. And I think it says a lot about the people of the World Health Organization, that they place their highest priority on serving the member states of the World Health Organization and serving the people of our world in our collective effort to help people to enjoy the highest attainable standard of health and to deal with this immediate and urgent emergency that we have now in China.
The more than 600 employees of the World Health Organization in the Western Pacific region, rejoicing in their proud history, responding to health emergencies, uniting the world against disease, promoting equity in healthcare, fostering peace and development on World Health Day and every day.